Hi, and welcome to Autism Talk TV. I'm Alex Plank.
And I'm Kirsten Linsmith.
And I'm Jack Robeson.
And we're here at the ASA Conference 2011 in Orlando, Florida.
This is the first of many episodes that we filmed here.
All right, guys, let's start the show.
Kirsten sat down with Dena Gassner. Let's see how that went.
Hi, we're here with Dena Gassner at the ASA Conference in Orlando, Florida. Dena, do you feel that your experience as a woman with autism is different from that of a man with autism? And if so, how?
Well, it's been my experience that a lot of men who have autism that have highly specialized expertise are valued for that. But in our culture and society, women are more valued for relationship building and their interaction with other women. And so as a woman who's more interested in more intellectual things, it's been difficult at times. The other problem I've had too is that women are traditionally the executive function, if you will, the organizing system for the entire family unit. And I've been responsible for that for my family of 4, and it's been difficult having my own organizational deficits.
Yes. And can you tell us about when and how you got diagnosed?
I was in the middle of getting my master's degree at a university-affiliated program on developmental disabilities. I was 38 years old. I'd been part of the autism community on behalf of my son, who is now 21, that had autism for over 15 years. But I had not connected the dots because I'd only been looking at the male expression of autism as my example. And it wasn't until I was in my 30s that I started meeting other women on the spectrum and started to see that many women on the spectrum manifest differently than the male phenotype. And so I went and got diagnosed. Tony Atwood led me to go get my diagnosis, so I owe him a great deal.
And on that topic, what's your opinion of the idea that there are more autistic females out there than are diagnosed and that women present differently or compensate differently and are often missed?
In many other communities, Tony Atwood's clinical practice as an example, he's seeing a ratio that meets 2 to 1. And I believe that because women are conditioned by society to be more social and to be more connected and relational, that they actually sort of get more training to do that than their male counterparts. As a result of that, it kind of camouflages their autism. However, if you look at the way even girls play, there's still a script and a rigidity to their play habits that are unusual for other women on the spectrum. But I think we need to start looking at a female prototype for the phenotype of Asperger's and autism, or we're going to continue to miss many women. Another thing, a lot of women on the spectrum come through to their diagnosis through the back door of mental illness. Their manifestations are perceived as a mental illness rather than a developmental issue. And we are also seeing a higher incidence rate of eating disorders. And a lot of girls are being diagnosed through the back door of an eating disorder as their primary condition, and then the Asperger's comes to the surface. So I do believe it's closer to a 2 to 1 ratio if there's even a bias at all.
And what is your opinion of those who say that autism and femininity conflict and the whole, super masculinized brain hypothesis with autism and that kind of thing? I don't know what you've heard about that, but...
I think, again, that women, even women who tend to be more, I consider myself to be a more logical brain type of woman, but I don't necessarily think that we're more male-brained per se. I do think we're more logical, and we tend to culturally associate logical brains with masculinity. I don't know that I go there. I can also say that I don't find the things that culture says that are important for women, like housekeeping and hair and beauty, is a high priority. I do it for functional reason. And also I think that women who have Asperger's, sometimes it's about executive function.
Do you have any advice for other women on the spectrum who may not be as well adjusted?
Wow, I have good days and bad days with well-adjusted, but I think more globally, I think for anyone on the spectrum, I have found to have a much more greater of success by being very open about my autism. I sit on a lot of statewide committees for autism in the state I reside in Tennessee. I've been given a lot of responsibility here at ASA on the panel of Spectrum Advisors and facilitating the pre-conference today. And I believe that part of the reason I'm successful at that is that I give people permission and I solicit feedback to help redirect me or to help me with clarification if I say something without a filter. And I think that a lot of people who are not succeeding with Asperger's are people who are kind of embarrassed and ashamed of their difference. When you compare that to a person who uses a wheelchair, they don't say, gee, I'm really sorry, I hate to bother you, I'm really embarrassed about this, but could you show me where the elevator is? But people who have invisible wheelchairs are often less comfortable with that. And so I find that even a partial disclosure, hey, I'm directionally challenged, can you help me do this? Or full disclosure, like with the airport at TSA, I fully disclose to protect myself from people misunderstanding me. I think that it makes life easier. It's just asking for accommodations that a lot of people ask for. And we need to be more comfortable in our skin in terms of doing things like that.
Yeah, well, thank you. It's very good, very educational, and thank you for doing this interview with us.
Thank you for having me. I appreciate it. Welcome to ASA.
So, is that the end?
We chatted with Claire Dumke. Let's see how that went. I'm saying it again.
Hi, everyone. We are here with Claire Dumke. She just presented at the ASA conference in Orlando and gave a talk on executive functioning. Thank you so much for joining us, Claire.
Thank you.
So my first question for you is, I am very bad with executive functioning. I cannot organize very well. I have trouble remembering dates. I try to use calendars. Sometimes I put it in the calendar, sometimes I forget. What is some general advice you could give me?
So I think that, as I talked about during my presentation, that consistency is really important, because if you don't use a tool, then it's not going to be very helpful, right? Just like if you don't pick up your dumbbells, your muscles aren't going to get any bigger. So I think consistency is very important.
Who do you work with the most?
So I'm a licensed clinical psychologist, and I specialize in autism spectrum disorder. So I work with children all the way to, I think 2.5 is my youngest client, all the way through to adulthood. My oldest client that I did a diagnostic assessment on was 65. So I work a lot with the adult population because I'm in Colorado, and there's not a whole lot of providers that work with the adult population.
A lot of people on the spectrum have trouble with driving. What do you recommend there?
I think that practice. I think repetition across varied settings is really important, but I also think that recognizing that maybe driving is not a skill that is something that maybe all people on the spectrum should do, because it can be extremely stressful, because one of the things that people on the spectrum struggle with is filtering out information, and a lot comes at you when you're driving. And so I have a lot of clients who have really successfully navigated the public transportation system as a way to kind of get through daily life.
And what do you recommend if they're not in a big city? Do you think it's important to be in a big city with transportation, or?
Not necessarily. It definitely would make it more difficult if you're in a rural environment and driving is not an option. But I also know I have a lot of clients that have successfully gotten their driver's license and are good drivers, but it's one of the things that's more stressful for them, I would say, in their daily lives, and it does require probably more practice across varied settings than for other people.
Could you tell us what the most important thing is to maintain the consistency, to achieve the consistency that can help with executive functioning?
I think it just depends on what your particular issue with executive functioning is. If it's organization, then or forgetting dates, then making sure that all those dates go into your planner, and setting aside time, whether it's each week or each day, to sit down with a planner and really go through, what does my week look like? What do I need to input into my planner so that I'm not missing anything important? If it's initiation, kind of giving yourself motivators. So saying, I'm not going to go play video games or go out with my friends until I finish my laundry or clean up the kitchen, things like that.
Well, Claire, thank you so much for talking with us. We really appreciate it.
Thank you. It was a pleasure.
Thanks.
Let me see. I'm trying to think of something to say other than let's see how that went. Here's Robert Naseef.
So we're here in Orlando with Robert Naseef, who is on the panel, or you're chairing the panel that I'm speaking on about fatherhood. Why don't you tell me about the panel?
Well, it's going to be kind of similar to what we did last year. We have 3 fathers on the panel, and they're going to talk about their experiences with their sons who have autism. We have 2 people with autism, you and Stephen Shore, talking about your experience growing up and how your dads contributed to your lives, and also maybe how other male role models contribute to the lives of kids growing up on the spectrum. And we also have 2 service providers who are going to talk about how they try to engage fathers both in the lives of their kids and in the programs that are designed to help kids with autism.
Could you give me a brief overview of how you think a lot of fathers should be acting towards kids with autism? Because I know when a father gets a diagnosis, he doesn't know what to do.
Well, often a father's really at a loss because as men, we immediately are thinking about how do we fix this, and often we feel powerless. We find out it's unfixable, and men tend to shut down.
Sure.
But I think raising a kid with autism for dads is both similar and different from raising any other kid. So one of the things I always ask dads is, how did your father help you? What are your best memories of you and your father? Because a lot of those same things help fathers who are raising kids with autism.
And as a father, what was your reaction to the diagnosis of autism?
Well, I was determined to fix it, determined to make it go away, and also thought I'd never be happy, never laugh again if my son didn't recover from autism. And I guess life taught me to be another way because my son didn't start talking again. He's at the severe end of the spectrum. So he taught me to live life as it is and to accept him as he is. So that's the lesson I bring to families who are raising kids with autism, that whoever your child is, if you can learn to be with them, you could have a good life. And people grow and develop, kids grow and develop, but the main lesson is that I think people with autism teach us is being present.
How old is your son?
My son Tariq is 31 now.
Okay. And when was he diagnosed with autism?
He was diagnosed around 4 years old.
Okay. So I know a lot of people have been citing this study that says that 80% of marriages that have a kid with autism end in divorce. Is that true?
Absolutely not true. This statistic has no evidence, in fact. It's been repeated and repeated until people think it's true. Now, there's a recent research study. Brian Friedman, who's going to be here on Saturday, Dr. Friedman will be co-presenting with me a workshop called From Research to Real Life, Marriage and Autism. Actually, the divorce rate of families, couples where a child has autism is roughly comparable to the national average. In fact, a lot of people are actually brought closer by having to work for the common good of their kid.
All right. Well, thank you so much for joining us. It was a great time talking to you, and I look forward to speaking on the panel with you.
Oh, it'll be great
Saturday.
having you again, Alex.
Thanks.
And you were really cute as a little kid.
All right. Well, thanks for joining us. Do you have anything else to add, Kirsten?
Thank you for watching. I mean, I hope this was interesting. Hope you learned something.
And Jack, let's let you do the last thing.
Bye.
Bye-bye now.
Bye.
Bye. Bye-bye.